Yes, we can. All right. Hi, everybody. Thanks for your patience. We are very excited today to present to you. My name is Leah Sigler. I am president of the TeleDentist, and with me is Dr. Maria Kunstadter, our founder, our chief passion officer, our CEO, you name it, that is she. And we are going to share our screen and talk to you about um, teledentistry in the emergency department. Let me go ahead and get my slideshow up and running. Voila, here we go. So, thank you again for coming. It's nice to see everybody. Uh, Today, the teledentist wants to present enhancing emergency and urgent care with teledentistry. Our goals in this are to go over a couple of use case scenarios to help reduce the ED overcrowding, cut costs, and improve patient outcomes. So, toothaches in the emergency department and urgent care are tremendously common. Unfortunately, every 13 seconds in the United States, a person enters the emergency department with a toothache. And for those of us in our little bubble of insurance and having an actual dental office, there are millions, in fact, what is it, 40, 50% of the people in the United States do not have dental insurance. And even more than that, about 50% of those 50% don't use their insurance. So when they have a toothache, they're immediately scared. They are confused. They don't know where to go. And thus they go to the emergency department or urgent care. It's mostly millennials who desire and need access to immediate care. They want it, a split second. And we're ready to go, they think, than urgent care for their concern. So in the United States, again, about 2.2 million people every year, and they're racking up a healthcare dollar bill of about $3 billion.
It's healthcare, it's medical expenses, not dental expenses. And I'm going to
Correct.
encourage you, if you are one of those people that have dental insurance but don't use it, there are maximums yearly. I am a dentist, and every year people would come in at the last minute and have not used their benefits and want all their work done, and you just can't do it. So use your benefits, get preventive care, see your dentist, and if you're in the half the population that doesn't have a dentist and you want to go to the emergency room, let's talk about how to avoid those kinds of problems.
So one of the main issues with this whole scenario is that there are no dental professionals in emergency departments or urgent care, unless by some miraculous coincidence, this one location has an oral surgery resident, and they happen to be there when you present with your issue. So it's causing more overcrowding. Uh, in locations that are already understaffed and overwhelmed. Level one emergency, which has very low reimbursement rate, and it's basically the ED doctor's bane, is what they've told us, pain in their uh, underparts. And the patient's going to sit there for 4 hours and get not the appropriate treatment. And unfortunately, it's also causing ED docs and nurses to practice outside the scope of what they learned and are licensed in.
And
So,
everybody attending knows that when someone comes in with a toothache, they bring the family. They bring two or three kids. Sometimes they're in-laws. And so not only is the emergency room already crowded, but there are a lot of patients and people sitting there that don't need to be seen that are taking up space in your emergency room. In fact, we know the system is broken when, and I know you might have seen this on Becker, where in the middle of her shift, in the middle of the emergency room, a nurse called 911 and said, "We need help." And 911 came and helped them triage and manage all the patients in the ED during her shift at a hospital. And that system is broken, and we're here to
working.
fix it.
So our goal is to connect the patient with the right specialist so that you are not working to the top of your medical license, sending them to the teledentist, oral health professionals. And we're going to talk today about cases that we have seen in EDs and that we see in teledentistry every day. So for those of you that do work in urgent care, hospital, emergency departments, you name it, medical professionals, some of these cases might sound a bit familiar to you. You probably see them, unfortunately, too often. And we're going to discuss what you should do when somebody presents to your facility with a toothache or an oral health concern. We're going to test your knowledge with these 10 real life scenarios. And I'm actually going to pass the baton to Dr. Maria Kunstadter, again, who is a dentist. And she is the founder of this company with this in mind. Our legal name is ED Dental Services, so that we can help ED departments and urgent care centers triage to the appropriate specialist. So I will be manning the button, and Dr. K, take it away.
Well, it's also important to know that 95% of the patients that show up in an emergency room with a dental complaint are not medical emergencies. They don't need to be there. So processing them through the whole process of the emergency room, because EMTALA tells you you have to treat these people, we have a better solution than charges, waiting times, expenses, and patient inconvenience.
And low reimbursement, if any.
Yes.
Away we go.
All right. So we've all seen this. Knocked out tooth is brought in that with a young child with a tooth in her hand. A 6-year-old fell and knocked her tooth out. The parents are hysterical. The child's semi-hysterical. She's kind of cute. She's not hysterical. So what do you do in this case? You tell the parents to find a dentist. They've waited for 4 hours for you to do something. Or you pick the tooth up with your gloved fingers and maybe a gauze to make sure, is this a permanent tooth? Does this tooth need to be reimplanted? Is that a decision you need to be making? You recommend reimplantation to the parents, and you've got out your book, and you know that if you put it in within 24 hours time, that the survival rate's successful. Is it a tooth that needs to be reimplanted, or a baby tooth? And how do you know you're going to reimplant this the right way? You could always do it backwards, and Leah has a case to tell you about.
This is genuinely one of our dentists that works for us. Happened to him when he was doing his oral surgery rotation. He got called in the middle of the night for a child who had hit and lost a tooth. And by the time he got there, the ED doc had already reimplanted the tooth backwards. So the poor child, of course, had to go through the trauma of removing and reimplanting the tooth the first time, and then the doctor had to do that again and educate the dentist, ED doc, don't do that again. Don't reimplant a tooth unless you really know what you're talking about. Or
Contact the teledentist. So we can be in a kiosk, we can be on your own equipment with just a link to the teledentist where they'll speak to the right specialist, get the right instructions. The dentist will know, is this a tooth that needs to be reimplanted, how to reimplant it, or send them to the right specialist to do that. This saves staff time, saves the tooth a lot of times if it's a permanent tooth, and prevents unnecessary specialist visits for the patient and their family.
and the trauma. I mean, my goodness, it feels like us to us that children are born with white coat phobia. So imagine having an actual traumatic event and being able to help that child alleviate their fears and the parents as well. So saving them that factor as well.
Uh-oh, it's springtime. I am a dentist, and spring came and people were falling on their teeth all the time because they're so excited they can get out and run. Partiers will come in the middle of the night having fallen on their tooth and broken the tooth. So this 32-year-old presented with a broken front tooth. What would you do? You're going to go look for that dental kit again because you know that in that kit there's something you could be able to grab that broken part with. Should you take off the broken part? Now with new technology in dental offices, a lot of times that could be rebonded. Or would you contact the teledentist and have the patient present to the video consult with the teledentist and let them decide what to do, what's the best option for this patient, and get them referred for restorative care on this tooth.
I had a patient in my practice years ago who lost her front tooth to her child headbutting her. So they presented to the ED, and indeed, the poor child got a couple stitches on the back of the head, and the mom ended up losing the tooth because the protocol was not in place at the time. So she had to spend thousands of dollars getting a dental implant, and of course, a little bit of anger towards the child at that situation. No, I'm kidding, obviously.
So this is why ED docs roll their eyes. When we were writing more prescriptions for narcotics, patients would show up like this, dying of pain, but when you look in the mouth, you don't see any reason that they should have pain, but they say it's this tooth right here. On visual exam, tooth looks normal, and this patient is just dying of pain. And you can't decide, is she there for narcotics, for medication, because she doesn't have anything else to do. And again, that is the kind of quandary of decision making that you have to do when you see a patient that doesn't demonstrate a visual reason or causation for for the symptoms. So they've waited for 4 hours out there going, oh, with their kids and their family. You tell them to go find a dentist. Now, maybe if they'd been able to find a dentist easily, they wouldn't be there in the first place. That's a huge barrier to begin with. You give them non-steroidal anti-inflammatories and don't give them antibiotics as there's no visual sign of an infection. And guess what? The patient readmits. And this is a huge problem in emergency rooms. 22% of dental complaints are readmits, and that is ruining your reimbursement rates and destroying the flow of the emergency room. Plus it means the patient never got the care that they needed. So you can do that, or you can contact the teledentist, have them go to the teledentist kiosk down the hall, and we triage the pain, educate the patient on what could be causing the pain if there's nothing that shows on the outside, and we refer them to a clinic for hands-on care. And more importantly, we give that patient a link to the teledentist and say, don't come back to the emergency room. This is not a reason to be in the emergency room. Contact us when and if you have a problem down the road. Huge unburdening the ED for all these people that we call the frequent flyers that come back over and over again, and avoid antibiotic misuse. And back when we started this, it was avoid narcotic misuse again, not done as frequently, but we can stop readmits.
We used to say when we first started working with hospitals and EDs, if a patient presents like this, just like in the picture, point to the kiosk and say, nope, go right over there, because that is what we do. We have kiosks that can be put in a private area of your facility, and instead of person sitting there waiting, like Dr. K mentioned, just point and say, go over there. So
And we're using telehealth forward now. Now there's telestroke, there's huge telestroke. There just simply aren't enough neurologists in this country to meet all the demands. So there's telestroke, there's psych, the huge problem of burdening EDs with psych patients, and now teledentistry, because there's not enough dentists to go into all EDs, but a virtual dentist can be there when you need them, 24/7, 365. Now, this one, again, if the receptionist goes, go down the hall with this guy, guess what? We're professionals. This patient is sent to the teledentist kiosk. Teledentist comes on and says, oh no, this is a swelling that you need to go back and check in because this could be a life-threatening infection. And you're going to need IV antibiotics for this kind of infection because this is life-threatening. So as professionals, our job is to diagnose the patient and to triage them to the appropriate place. And in this case, it would be back to the receptionist and check in. You're going to need to be hospitalized for IV antibiotics.
and let's not forget Diamante Driver, who passed away from a tooth abscess, and even the NFL player that passed away because of untreated dental abscesses. It is across the socioeconomic border, and it is across the age groups that this can kill people and does kill people. And the teledentist, again, we've been around for 10 plus years. And in all of our patients, we've seen this about 2 to 3 times where we've actually said, you need to go to the emergency department, head there now. Because, like Dr. K mentioned earlier, it is 95% of people that present in EDs or UCs are not medical emergencies. So this 5%, unfortunately, does exist, and we are professionals, and we can tell them when they need to actually go and be admitted for that IV antibiotic.
Wisdom tooth pain. Here, moms and dads have just paid $8,000 to get these beautiful teeth straight. Then they send their child off to college, and guess what happens? The first month of college, their wisdom teeth start cropping in. So they don't know where to go. They go to the emergency room for this wisdom tooth complaint. So here are 22-year-olds presenting with jaw pain, probably an impacted tooth because it's way back here. And you can look in there, you can decide what needs to be done, but contact the teledentist because we know what needs to be done. We know how to palliate this patient. We know what kind of medication to give this patient. And we take it that one step further and get an appointment for this person with an oral surgeon after she's been on antibiotics for about 5 days, because you can't extract a wisdom tooth with infection being in there without causing further problems. So this is a perfect case of talk to the teledentist and they'll take care of you.
And we'll even remind them to wear their retainers just for mom and dad.
Again, so, because they don't know where to go. This guy just had a tooth taken out, but the oral surgeon's not in the office at 7 o'clock at night. So what's he going to do? He goes to the emergency room because dry sockets are very painful, more painful than the extraction, believe it or not. So you run around looking for that dental kit, thinking, oh, I'm just going to pack this with the dry socket paste. I know that's what needs to be done, but I can't find the dental kit. Don't know what to do. Should I put them on antibiotics? Or should you talk to the teledentist? And the teledentist can indeed tell them how to rinse it out, get them an appointment to get that dry socket paste put in at a dental at their oral surgeons. But in the meantime, between 7 o'clock at night and when the oral surgeon's office is open, this person needs help, and we can do that way by mediating his pain with medications and the right antibiotics, etc.
Unfortunately, for the dental field, dental offices are not open. What was it, 35% of the week?
24% of the hours of the week the dental offices are open.
And we have had multiple cases where the patient presents for a teledental consultation because they can't get a hold of their doctor. They can't get a hold of their dentist who just did a procedure and they're about to head to the emergency department. So instead, we've obviously stopped them since they came to us first. And unfortunately for this 55-year-old male, that's where he ended up. And we are very apologetic, on behalf of the dental field that we have said it that way. But again, that is why the teledentist exists to cover for those remaining hours, 24/7, 365 nationwide.
This lovely woman doesn't have a dentist, didn't know what to do. Her crown's coming loose and it's very sensitive. So she shows up in your emergency room. What are you going to do? Hopefully, you're not going to make her wait for 4 hours and go through the emergency room process. Send her to the teledentist because we can advise her where to go to get temporary glue material, who she needs to see to have it glued in permanently, and tell her about the discomfort, what she should expect, and how to manage putting that tooth back in until she gets into her dental office. Surely not an ER visit quality patient here. And her name is Shirley, absolutely. And this is probably my favorite, which we all hate these patients. The child's screaming, the parents are hysterical, blood's coming out because the tongue bleeds very badly. There's blood all down the front. Everybody in the emergency room is going, oh. So this one instance raises the level of anxiety in the emergency room just because this is all going on, and the child's bitten his tongue. You're not going to be able to get the parents calm down or the child calm down long enough to be able to get in there and do anything. So send them down the hall to the kiosk, and the teledentist can work with the child to stick out their tongue. Oh, there's no laceration there. Yes, it's bleeding, but you're going to be okay. And again, my favorite, I'm a mom and a grandmother, is the popsicle cure. Popsicles cure everything, and they certainly help inflammation and pain in the oral cavity. So let the right specialist see this child. Non-invasive. They're not afraid to talk to a computer. They're afraid to talk to the white coat phobia guys that come at them like this. And the parents are calmed down. The child's been taken out of the emergency room very quickly because we can see patients within 10 minutes after a patient's checked in with the teledentist. So they're in and out, going home to get that popsicle very quickly and managed appropriately.
Kids, or even if you have chronic mouth ulcerations or just pain, we have a fantastic product on our marketplace. I had to do a plug here. Check out the Soothie Pops that will help not only this child, but like for canker sores and braces, you name it. It's a very delicious popsicle that adds a soothing, smoothing touch to it. So there's my plug.
And again, this is going to show up because he's not been to the dentist in I'm not sure how long, so he doesn't have a dentist, but he's bitten into something and he feels this lump on his side of his tongue going, oh, this doesn't look good. I've got my cell phone and can take a picture of this. Oh, that's not good. I better go have him look at it. The doctor look at it. And that's what a lot of people think of as emergency room. Let's have the doctor look at it. So this patient shows up. It's not urgent. It's not even emergent, but a solution needs to be solve, and it basically let the teledentist look at it. Looks like leukoplakia. Get them a referral to an oral surgeon or a periodontist to have it biopsied, and the patient's in and out again within a half an hour, 45 minutes, out of your room, taken care of. We send you a report for every incident that can be scanned into the patient's EMR, can be scanned into the record as a dental consultation. because it is a dental consultation, and the entire report of the event is sent to you through secure email every day.
Another relentless plug. We're working with a new group. It's not new, they're new to us, that does oral cancer detection with saliva testing. So if you're interested, message me and I will get you a referral to that kit. You can do it from home and detect potential oral cancer in the early stages.
And this is the one, again, the eye rolling. This patient's been the fourth time this month. You see her and you go, oh no, not again. It hurts. It hurts. She can't tell you where. She can't, there's no evidence or causation. It just hurts. So you initially try and triage her with some anti-inflammatories, and a week later she's back, it still hurts. There's really no looking at the patient in the mouth, outside the mouth, a solution to this. You can see her 3 or 4 times. You're not going to get paid for the second or third or fourth time, or you can send her to the teledentist for a much lower cost visit. Again, the teledentist can consult with her, get her out of pain, get her to the right specialist to see what's going on, and give her, again, that link to the teledentist should she have problems down the road not to go to the ER, so that your reimbursement and your readmits have been reduced dramatically by us managing this patient for you. So, what should the emergency room doctors and the ED doctors do, and the urgent care doctors do? According to the American Medical Association Journal of Ethics, and we know there's a responsibility to the patient. What is that responsibility according to the AMA? You have two ethical responsibilities toward the patients. It's number one is to care for the patient in the moment, and number two is to provide appropriate follow-up care for care. And number two is rarely done. Just go see a dentist is not really providing follow-up care, but the teledentist manages both of those for you. We care for the patient in the moment with the right specialist, the right prescriptions when need be, the right palliative recommendations as need be, and we take it on responsibility to get them an appointment in an office for hands-on care when it's indicated. So we're here to manage your ethical responsibilities to these dental patients, and reduce the eye rolling when you see a patient come in for a dental complaint.
So you work in the ED, work in the UC. You know how many dental cases you see every month. And we've said this statistic multiple times, but 95% of them don't need to be there. And 95% of them are causing your overcrowding. They're contributing to your understaffed team members being burnt out. And they are not giving you reimbursement rates that are substantial enough to pay your staff. And therefore, the teledentist coming in, triaging to us for oral health concerns can save staffing. You're literally hiring a virtual dentist to be part of your organization. We do credentialing, we do patient management, we do it all within so that you don't have to. And therefore, it improves your patient outcomes and your efficacy. So, efficiency, pardon me. It's a win-win for everybody, for the hospital, for the staff or employees, and for the patients. And it's time to start today. Um, we do dental, so you don't have to. And we want you to be a part. Oops, she says one more second. Go on.
I just want to say, don't talk to the front end because you can run up charges and look really, your RVUs look really like you've done a lot of billable hour fees. Talk to the people in the back that get the rejections, get the reimbursement rate of pennies on the dollar or no reimbursement at all. The billing people that are billing people that say it's self-pay and not getting any money. So the front end, you can make it look really like a boom procedure to provide. Check with the back end and find out how much of this is reimbursed, how much is paid, what kind of money loss is happening on these dental emergencies. So it's not just win-win, it's win for the patient, win for the hospital, and win for the billing department as well.
3 billion healthcare dollars. I mean, that right there. Imagine what hospitals, EDs, UCs can do with $3 billion back into your environment to improve your facility. I mean, that's astronomical. So we want you to join us.
Mhm. So we are actually trying to make huge strides in dental emergencies because it's only going to get worse with Medicaid being reduced and fluoride coming out of the water. Things are going to get even more crazy with these dental emergencies. But we are working with CTEL, which is the Center for Telehealth and eHealth legislation in Washington, D.C., to do a pilot to study the financial effects, the patient effects, and the coding and billing effects so that we can get policy changes for all these millions of people to get more effective care so that we can get care provided to them with the right specialist at the right time, right place. And join us for this pilot. We would love to talk with you about being part of the pilot where we look at financials before, financials after, and patient care and really do an assessment of the benefits of teledentistry and then go to the policymakers and change the policies about how these patients can be triaged and managed in your own facility or out of your own facility.
Yes, to answer the question in the comments, I will definitely be sending this link out to everyone. It's going to be all over our social medias, LinkedIn, for those obviously you follow us. Yeah. And you can't say no to a pilot. I mean, it's short-lived, and when we prove the efficiency and efficacy of this program, it's going to be even more um, amazing that you joined us in the beginning and helped move the needle on healthcare. So contact us today. Here's our information, my information. We would love to see you. We're also going to be exhibiting at the Urgent Care Association conference in a couple of weeks in Dallas. So if anybody is coming to that, yeah, please let us know. And we would love to meet you. Come swing by for a demo of how easy it is to connect to a teledentist. And thank you all again very much for joining us today. We hope we have educated you on not only the importance of teledentistry, but some of the cases that you didn't realize do present in the ED and how the teledentist can be a game changer for urgent care and emergency departments. And thank you again.
Thank you. It's 5505 in the phone.
I did not.
Yeah, 5,000.